If you wake up at night again and again to urinate, if your urine stream feels weaker than it used to, if starting urination suddenly takes effort, this may not be normal aging. These changes can be early warning signs of prostate enlargement, and when ignored, this condition can slowly affect your sleep, bladder function, and even kidney health. The earlier you understand what is happening inside your body, the easier it is to prevent serious complications. Benign prostatic hyperplasia, or BPH, is one of the most common conditions affecting men after the age of 40. Many men experience symptoms, but assume it is simply part of getting older. In reality, it is a biological process that can be understood and managed. This video is for educational purposes only. It does not replace professional medical advice. The information presented here is based on scientific research and publicly available medical data. Let's begin with the basics. The prostate is a small gland located just below the bladder. It surrounds the urethra, the tube that carries urine from the bladder out of the body. In younger men, the prostate is about the size of a walnut. Its role is to produce part of the fluid that makes up semen. As men age, hormone levels gradually change. One important hormone is testosterone. Inside the body, testosterone can be converted into a more active form called dihydrotestosterone, or DHT. DHT continues to stimulate prostate tissue growth over time. This gradual increase in prostate cells is called hyperplasia. Hyperplasia simply means an increase in the number of cells, causing tissue enlargement. In BPH, the prostate slowly becomes larger year after year. Because the urethra passes directly through the center of the prostate, even moderate enlargement can compress this tube. When the urethra is compressed, urine flow becomes restricted. This mechanical pressure explains most symptoms. Early signs may include a weaker urine stream. You may notice it takes longer to begin urinating. Some men feel as though the bladder does not completely empty. There may be increased urinary frequency during the day. One of the most common warning signs is waking up at night to urinate. This is called nocturia. If you regularly wake up 2 or more times per night, it may indicate prostate enlargement rather than simple aging. As the condition progresses, urgency can develop. Urgency means a sudden, intense need to urinate that feels difficult to control. Some men notice dribbling at the end of urination. In more advanced cases, urinary retention may occur. Urinary retention means the bladder cannot empty at all. This is painful and requires immediate medical attention. It is important to clarify that BPH is not prostate cancer. It is a non-cancerous enlargement. However, both conditions can produce similar urinary symptoms. That is why proper evaluation is essential. Risk factors include aging, excess abdominal fat, metabolic syndrome, and physical inactivity. Metabolic syndrome refers to a group of conditions including high blood pressure, elevated blood sugar, abnormal cholesterol levels, and increased waist circumference. These factors are associated with chronic inflammation and hormonal imbalance, which may contribute to prostate growth. Diagnosis usually begins with a clinical examination. A digital rectal exam allows a healthcare provider to assess prostate size and texture. A blood test measuring prostate-specific antigen, or PSA, may also be performed. PSA is a protein produced by prostate cells. Elevated levels can occur in BPH, inflammation, or prostate cancer, which is why further evaluation may sometimes be needed. Treatment depends on symptom severity. For mild symptoms, lifestyle adjustments can significantly improve quality of life. Reducing fluid intake before bedtime may decrease nighttime urination. Limiting caffeine and alcohol is important because both can irritate the bladder. Regular physical activity improves circulation and hormonal balance. Maintaining a healthy weight reduces metabolic stress and may slow progression. When symptoms become more disruptive, medications are often prescribed. Alpha blockers work by relaxing smooth muscle in the prostate and bladder neck. Smooth muscle refers to involuntary muscle tissue that controls automatic functions. When this muscle relaxes, urine flow improves relatively quickly. Another group of medications, called 5-alpha reductase inhibitors, reduces the conversion of testosterone into DHT. Lower DHT levels may gradually shrink prostate tissue over several months. In cases where medications are not sufficient, minimally invasive procedures or surgical options can remove excess prostate tissue and relieve urethral compression. Ignoring progressive symptoms can lead to complications. Chronic urinary retention may weaken the bladder muscle. Over time, increased pressure can affect kidney function. Recurrent urinary tract infections or bladder stones may also develop. However, there is reassuring news. BPH develops gradually. It is extremely common, and in most cases, it can be effectively managed when identified early. If you notice persistent changes, especially frequent nighttime urination, weak stream, or difficulty starting, do not dismiss them. Awareness allows early evaluation and appropriate management. Prostate health influences sleep quality, daily energy, confidence, and long-term organ protection. Understanding what is happening inside your body reduces uncertainty and replaces fear with knowledge. Evidence-based medicine provides clear and effective pathways for management. Early attention leads to better outcomes. Knowledge is not panic, it is protection, and protection supports long-term health.